Welcome to Just Minding My Business, and I'm excited to bring to you today Christian Brindle, who is the founder of Everything Senior Insurance and a nationally recognized expert in the field. Christian has published multiple books about Medicare, helped countless people with their plans all over the country, and hosts the extremely popular Everything Medicare podcast. Christian believes that understanding your choices is extremely important in making a good decision with your Medicare. He is also a father and a loving husband. So, welcome, Christian. I am so glad that you're here because I remember when I had to do the Medicare thing, and it was like walk, 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 walk. It's a whole different terminology.
Yes, yes. Well, first off, Ida, thank you for having me on your show. I'm a fan of everything that you're doing, and it's a pleasure to be here. And you're so right. You hit it right on the head. It is such a different language of sorts. When it comes to Medicare and all the terminologies they use, and they frankly they just don't make it easy for people that are becoming eligible for it. And it's extremely complex and complicated, and I feel like, my organization does a very necessary service in providing clarity and kind of translating really what things mean and what people need to be thinking about when they're making plan selections.
Yes, absolutely. Because if you're coming from corporate America, it's like apple and oranges,
Yeah.
you know,
Yes.
the terminology, and it's really nobody to help you through it. I mean, of course, you get all of these calls during enrollment time,
Hmm.
and it's still, it's not, it's just not explained well. Let's put it that way. It's not explained well. So let's go ahead and jump right into it. I think they have, what is it, A, B, C, D, plan, all these letters for these different types of plans. Can you talk about that?
Yes. So one thing that people typically at first will get overwhelmed with when they first have to take a look at Medicare is all the different parts, right?
Mm.
So with Medicare, you have parts A, B, C, D, um, and understanding kind of where all the parts fit is really where a lot of the confusion ends up lying. But I feel like what we've done over the years is we've really done a good job, I feel like, of articulating it in a way that is extremely easy to understand and digestible. So if anybody that's listening to this might be approaching the Medicare decision, or maybe you have a family member or somebody else, it's a lot simpler when when it's really broken down than it might sound. It sounds a lot more intimidating, I feel like, than it really needs to be. So with Medicare, it's true you have all these different parts, but if everybody understood that there's two parts of Medicare that come from the government. You have Medicare Part A and you have Medicare Part B. And the best way I can explain those from a 10,000 point view is that they both work like two pieces of a puzzle that fit together to give a person medical coverage. They both cover different areas of medical coverage, but when you put them together, you have medical coverage, hospital coverage, doctor's appointments, surgeries, things like that. And those are the only parts of Medicare that come from the government. Everything else you ever hear about comes from an insurance company. And so Medicare has a lot of limitations of the coverage if that's all somebody had, right? So on that medical coverage it gives you, they give you about 80% coverage. They leave behind 20% of medical expenses for the beneficiary to have to pay. And there's no limit to that. It could be 20% of anything. There's no maximum out of pocket or stop loss. In addition to that, Medicare doesn't cover prescription drugs, dental, vision, or hearing, so it's very one-dimensional coverage. And so, what my job and my company's job is when we work with a client is on helping them understand that when you get onto the Medicare path, for the vast majority of people, probably 99%, there's two different directions they can go. You have a Medicare supplement direction and you have a Medicare Advantage direction. And our job is to really help people understand which way is better for them. But everything you've ever heard about Medicare related falls into one of those two camps. And so if you can figure out which one is better for you, that's 90% of the battle right there, in my opinion.
Wow. So what is the difference between Advantage and what was the other one?
Medicare supplement. Yeah.
Yeah, and Medicare supplement. Because I've seen that, especially when in my enrollment period time.
Mhm.
And so what's the difference?
Yeah. So you mentioned earlier, right? Like employer plans and Medicare plans are like apples and oranges. Well, the same is true, in my opinion, with Medicare Advantage and Medicare supplement plans. They're very much like apples and oranges. They're two different options that a Medicare beneficiary has, but they both have their unique pros and cons to them. So I'm a big believer that one is not better than the other. It really depends on the needs of the client that we're working with. But Medicare supplement, from a very simplistic viewpoint, is a secondary insurance, right? So I'd say maybe path A that you could go, Medicare supplement, is a secondary insurance. You pick it up through a private insurance company. So think Humana, Aetna, Blue Cross, United Healthcare, somebody like that. And they act as a secondary to Medicare. So I mentioned earlier, Medicare provides you with medical coverage, right? But at 80%. So the supplement's job is to simply pay that 20% that Medicare's not picking up. So when you have that, you're double covered and you have the primary, the secondary. Between the two, in most cases, you have very little, if any, depending on the plan, medical out of pocket. So you either have full medical coverage or close to full medical coverage. Um, I would say it's the best of the best medical coverage that money can buy. Um, but when you pick up a Medicare supplement plan, it doesn't come with prescription drug coverage. It doesn't come with dental. It will only pay for things that Medicare's already paid for first. So when you do that, you have to pick up a separate prescription drug plan, a standalone. You have to pick up a separate dental plan, a standalone. So when you go that way, you're having to pick up three or more different plans to kind of complete your coverage. And it's a little more confusing, I think, for the average person that's used to one plan that provides everything. Um, the Medicare supplement plan, depending on where somebody's at in the country, varies in cost. It a lot of times will probably be between $100 and $200 a month, depending on your state. Um, so it's a little bit more costly. The prescription plan usually costs something. The dental plan usually costs something. So it could be in some cases that, you know, above and beyond anything you pay for Medicare, which Medicare for most people has a premium for Medicare Part B. It's usually 185. Um, so factoring Part B in and all your other plans, you're probably looking at somewhere between $300 to $400 a month, depending on your state, for everything when you go that way. So it's the more expensive option, but it's also the premium coverage. Um, the pros of a Medicare supplement to me are great medical coverage. You have very little medical out of pocket. You don't have any provider network like most insurances. You can go any provider you want in the country, not just in your state, that accepts Medicare first. Nowadays, 98% of providers and medical providers accept Medicare. Doesn't matter who your supplement's through. Um, and so those are probably the pros of that. The negative side of it is it's complex. You're dealing with multiple plans. It's a little confusing, especially for people that have had traditional insurance throughout their life. And Medicare supplement plans go up in price as you get older. They all do it. There's really no way around it. So it's continuously getting more expensive. And changing that plan from one to another later might be a little difficult because you have to go through health questionnaires to change your plan. You have to be medically healthy enough to change. You can't just change whenever you want. So that's your Medicare supplement side. Whereas the Advantage side is different, right? You're running your Medicare through an insurance company. They're administering your benefits for the government. The government funds them because they don't have to pay that 80% anymore, right, on your medical bills. And you have a plan that provides you with medical, prescriptions, dental, vision, hearing, all in one plan, very similarly to any work insurance you've had or any insurance you've had under 65. Um, and it's like your traditional insurance you can expect, right? It has networks of hospitals and doctors. You have to stay in the network. Um, the insurance company might have prior authorizations and additional requirements to approve things. Um, but most of the time, Medicare Advantage plans either have a very low premium because they're funded by the government, or they might have a $0 premium altogether. Most areas will have a lot of $0 premium options. So in that case, you're paying the 185 for Medicare Part B, and in some cases, that's all. You're not paying anything more than that. Um, and I'd say the pros and cons of Advantage. The pro is it's much less expensive premium wise. Everything's in one plan. The negatives are you're restricted to a network. You have to go through the insurance company for everything. And also, you do have more medical copays that can be associated when you do use it, right? Whereas with Medicare supplements, you might not have that as much. So there's more potential out of pocket for you to be responsible for when you do use it. So that's kind of the extremely simplistic viewpoint of the two options. And they're just different. It depends on somebody's medical history, their usage, what they prefer, what they like their plan to look like, and also kind of what their budget is and what they can afford to spend on their plan.
Yeah, well, I'm glad you explained that so simple. You
I
really
try.
did. I mean, because I have advantage because I'm like, I need one payment. Now I'm all these other little buckets. But from I'm with Aetna. So they
Okay.
pretty much cover quite a bit. And my husband had a terminal illness, and
Oh, I'm
they
sorry.
they took care of him really, really well, in
That's good.
terms of you know, extra things that we could do, therapies and things like that. So I was pretty satisfied with them. But the big question that everybody want to know is with the current administration, with all of these
Hmm.
different changes coming down the pike. I know you can't foresee the future, but what's your thoughts?
Yeah, no, it's a great question. And there's been some things that have already happened this year that can kind of give us a little bit of a forecast of what we're going to see going forward. So, you know, one thing I've learned over the years, I've been doing this 11 years. This is my 11th year in the Medicare space. I have gone through multiple different administrations, the Obama administration, the Trump administration, the Biden administration, now the Trump administration again. Um,
Mhm.
and every time there's a change of power in the administrations, there's always fear of them coming in and getting rid of Medicare, weakening Medicare. And there's a lot of things that can be done administratively that impact Medicare. Some people know this, but a lot don't. Um, a big reason why the administration matters so much in terms of Medicare is they appoint a position. The president does, and a position of the CMS administrator. Um, and so that CMS administrator, some people may know because it's a very big name, is Dr. Oz, Dr. Mehmet Oz. And so he's been in that position a couple of months now, give or take. Um, and what we've seen so far on a very early basis from CMS, for those of you that don't know, the Centers for Medicare and Medicaid Services, right? They oversee Medicare, Medicare Advantage, what the plans will look like. Um, so for Advantage plan members, one thing a lot of people may notice if you're on Medicare and you're listening to this is from 2024 to 2025, we saw plans improve in some ways and weaken in others. And I'll explain what I mean by that in a way that we probably haven't seen any year that I've been doing this, right? My company's licensed in over 45 states. We work with people across the board. So we see things kind of from a broad perspective. And one thing they introduced in 2025 was a $2,000 prescription drug maximum out of pocket cap. This was legislation that was passed by the Biden administration, um, but really passed through Congress. There was more hands in it than just the Biden administration. And this had to do with the Inflation Reduction Act. And there's a lot in the Inflation Reduction Act about prescription costs, but also Medicare prescription drug coverage. And previously, one of the big knocks on Medicare coverage was prescription coverage. You know, Medicare plans had something called the donut hole, where when your utilization was too high on prescription coverage, your costs would go up. You'd pay a higher percentage than you would the rest of the year, right? And that was always a big knock on Medicare prescription drug coverage. And for many years, basically from 2005 to when Part D was implemented, up until really the last year or so, there has never been a maximum out-of-pocket limit on prescription costs. It could be anything. So I would see clients that were paying, even on the best plan possible, sometimes $5,000 to $10,000 in medication costs a year.
Mm.
And there were certain things you could do, right? You could maybe potentially order prescriptions from Canada or, Canadian pharmacies. There's things you could do. You could kind of work with the pharmaceutical company on assistance programs and things like that. But there was limits to what you could do. So come fast forward to now, because of the Inflation Reduction Act, starting January 1st of 2025, all plans were required by law to have this $2,000 cap, meaning the member cannot be responsible for their out-of-pocket of anything more than $2,000 in a year on prescription costs. This saved a lot of people that were paying a lot of medication costs a ton of money on prescriptions, which is a positive. The negative of that is the insurance companies had to start paying a lot more than they've ever had to pay before. So Advantage plans are made up of a whole bunch of different benefits, right? As you've experienced with your plan. And it's a makeup of medical coverage. It's a makeup of networks and who you can go to the doctor, who you can go to the hospital. It's a makeup of dental benefits. It's a makeup of glasses benefits, hearing aid benefits, gym membership programs, over-the-counter items where you can order things that aren't prescriptions, but things like aspirin, ibuprofen, fish oil, Band-Aids, vitamins, toothpaste, all of this stuff. It's a makeup of all of this in each plan. And so a vast majority of the plans in the country, because they now in January had to pay a lot more towards prescription drug costs than they did before, we saw a vast majority of plans in the country make cuts in other areas of their coverage. It's a domino effect, right? One thing gets strengthened, something else gets weakened, right? There's funding pulled from a certain area. And every company and every plan decided differently how they were going to do that. Some plans might cut their dental benefit down. Some plans might have reduced their provider network and cut ties with some hospitals. Some plans might have increased their medical copays or their hospital copays. So the effects were seen differently depending on the plan and depending on the area. But it was seen in the vast majority of plans, okay? So what does that have to do with going forward, right? That's what we're seeing this year. To answer your question, there's a lot of optimism that Medicare beneficiaries have had that maybe some of these benefits might strengthen back up again while still having the prescription coverage. Now, Medicare Advantage plans are all based off of funding they get from the government. If the funding isn't there, it is impossible, right? The last 2 years before this, CMS always builds in something that's known as a cost of inflation and medical care increase for plans each year. It's a percentage based off of inflation and rising costs of medical care to cover their bases and to make sure the carrier can still afford to provide the care. The last 2 years, it was in the 2% range of increase, which probably just covered them for inflation, if that. Didn't provide a whole lot of wiggle room for extra coverage and extra benefits. But come 2026, one thing CMS has already announced is that they're going up to over 5% increase for the insurance companies, partially because they see what's happened in terms of the domino effect of these cuts that have been made in 2025. So that will range. I think the number officially was an additional like $25 billion in funding for the insurance companies. What I think that will cause is maybe slowly but surely we start to see some of these benefits start to strengthen again on certain plans that have the budget to bring some of those plans back. So for me, I think more funding means that they believe in the program and that they're optimistic going forward. Um, and so I'm very optimistic about what we'll see in 2026. I do think the Inflation Reduction Act changes fundamentally changed the way that Medicare prescription drug coverage worked. And it had been that model, that old model, for basically almost 20 years. And so it will take a couple of cycles and a couple of open enrollments before we kind of get the smoke clearing on what plan structure will actually look like long term. But I'm optimistic about what we're seeing going forward. I think the plans are the future for Medicare, and I think they're strengthening every year. And Medicare Advantage market share is almost at 60% of people that are on Medicare. Medicare supplement market share is only about 22, 23%, and the rest are people on employer plans and retirement plans, things like that. Um, so I think for people that are on Medicare Advantage plans, more funding means potentially more benefits for you in a shortened layman's terms version.
Okay, well, that's a positive outlook for sure. Wow, Christian, I mean, you definitely know your stuff. So if people want to work with you, because you know the baby boomers are definitely entering the retirement arena. So
Right.
how do people connect with you?
Yeah, so my company, as I mentioned earlier, we're licensed in over 45 states. And we have multiple agents in our office that are fantastic, or every bit as good as me. Um, and we have a very great support team, customer service team. Not only do we help you find a plan, but we take care of you when you're on the plan and service your policy long term. I like to say we have lifetime customer service for our clients. And so the best way to get a hold of us is you can either check out our website, eseniorinsurance.com, or you're welcome to give us a call. Our home office number is 801-255-5340. That's 801-255-5340. And we can get a no cost, no obligation consultation scheduled with one of our licensed team members and take a look at your situation and kind of see what we might recommend.
Wow. I definitely needed you earlier this year because it seems like they call. Yeah, it's this during enrollment period, you get this flux of calls, but
Right.
nobody really shows up um, until after the fact. And it's
Yeah.
like, well, I already did it. Where were you when I needed you?
Right. Yeah. It's a real problem. It's a real problem. And in my world, in the insurance agent world, there's a very high turnover rate of people that do this. Only about 5% or so of people that do this that get their license are doing it 3 years after. That's a real statistic. There's a 95% turnover rate. So a lot of the people that you're talking to have not been doing it very long. They're not very seasoned. Not all the information is created equal. Not everybody's as knowledgeable as you might want them to be when they're advising you on your healthcare decisions. And so it's tough. It's tricky. We try to do our best to put ourselves out there and make people aware of what we do and and everything like that. But there's so many people getting onto Medicare. We'd love to be able to help them all, but it's hard. It's hard. Tens of millions of people.
Yeah, because I definitely believe that 95% because I haven't had the same person no time.
Yeah,
It's like it's always a different person. And I'm kind of like, once I feel comfortable with you, I like to work with the same people, but it's
sure.
almost impossible in
Yeah.
that industry for sure. Wow, this
Yeah.
is amazing.
It's
It just,
become very call center dominated too. Like one thing I
yes.
like about our organization, like with call centers, they're meat grinders. They'll bring people in as fast as they're leaving. And so
Mhm.
you just have that crazy turnover with whoever your account manager is, whoever's representing you. What I love about my company is even though we do a lot of business telephonically because we're in Utah, we're going to physically be with somebody that's in Texas, say, or Florida or Idaho or whatever that might be.
Mhm.
Um, but we're not a call center. We are a brick and mortar office. We are a real, office. And even though we are nationwide, we have a tight-knit team. Internally here in the office, we have a team of about 10 to 15, and so you're usually dealing with the same person, if not just maybe one of two or three different people, every time. And you're not dealing with a new person all the time. And we pride ourselves on that.
Oh, okay. Well, that's good to know because people like to, especially seniors, we like to work with people that we get used to. And then,
Yeah.
then we don't feel like learning no new folks, if you know what I mean.
Yes. I definitely do. I definitely do. And, I think it's understandable, and nowadays it's become rare that you feel a personal touch when you do business with
Yes.
anybody. It's just become a rare thing. And so, we understand that um, you don't get it in most areas of your life, but we want you to get it when you deal with us.
That's awesome. So again, how do people connect with you?
Yes. So they're probably the two best ways is you can either visit our website, that's eseniorinsurance.com. And you can check out some information there. You can find contact information for us there, or you're welcome to just give our office a call if you'd so like to do so at 801-255-5340, 801-255-5340. Those would be the best ways.
Yeah. So let's jump into your podcast a little bit.
Sure.
So I think it's host of the seven figures, or you have two.
Yes. So we have an agent facing podcast, and then we have a Medicare consumer podcast. So one thing that we also do with our organization is we mentor and train other agents around the country and kind of help them duplicate the success that we've had and how we work with our customers and clients and how they can do the same thing in where they're located.
Mhm.
So the other thing that's nice is if, let's say, you're in a state and you want to work with somebody locally to you. It won't be the case every time, but we might have an agent that we partner with that works with our organization in your area that we can hook you up with if you'd rather work with somebody in person than over the phone. So there's about 600 agents that we work with in that capacity across the country. Um, and so that podcast is kind of going over just things we're doing internally, marketing things we're doing, retention things that we're doing, how we get information out, how we stay organized, how we hire people, just kind of helping them have the tools to really put their business together in the right way. And then the Everything Medicare podcast, excuse me, um, it's hard to believe, but we just got to, I believe, the 8-year mark of that podcast. Um, and it's it's the first podcast that I ever did. And it's all about understanding your Medicare options. And if you kind of liked what you heard on this show today, there's a lot of that same type of talk and education on it. It's all about just understanding, what does Medicare cover? What's the pros and cons of different plans? And it does, and it goes deeper into the weeds in a lot of these things. And when I first started putting it together, our company was much smaller as well at the time. And I remember thinking to myself, I'm like, nobody's gonna listen to this. Nobody. And I'm like, it's a podcast about Medicare. Like, might as well listen to a podcast about watching paint dry, and the bubbles and the whatever. But to my surprise, people did listen to it. Not only did they listen to it, they loved it. Um, and so been doing it for 8 years, and to this day, um, it is still. We actually had somebody call in yesterday, I want to say, and they asked ChatGPT what are the best Medicare podcasts. It recommended ours, and that's how they heard about us, and they called in to our office. And that to me, I was like, wow, that's amazing. But yeah, the Everything Medicare podcast, you can find it on any podcast platform. that you might want to listen. Apple Podcasts, certainly, Google Podcasts, Spotify, YouTube. It's all over the place. It's on like 20 different websites and platforms. So, um, yeah, we're getting close to a decade of doing it, and it's been so much fun to do. And I hear from people all the time that the podcast really helped them take a lot of confusion out of making those decisions. And I love to hear that. That's always a lot of fun for me to hear.
Yes, absolutely. Because that's a scary time for a lot of people, making that transition from corporate insurance to quote unquote government insurance, so to speak.
Sure. Yeah,
And I mean, to me, the government always say to make it more harder than it needs to be.
agreed.
Their
Yep.
verbiage is not user friendly. It's like, what the heck are they talking about? You know?
Yeah. Yep.
So,
And it's true, like the government is is great at what I call taking something and communicating it in gobbledygook.
yes, yeah,
Um, so even if, the concepts that I've shared on this show today were broken down in English, hopefully. That's always my intention anyway. But they can communicate the exact same things in Medicare booklets and Medicare's website and everything like that. And it's communicated in a way to where it almost seems like a different language. And that is the
yeah,
government for you, though. That is how they communicate things. And um, it's overcomplicated. And a lot of times it's passed through multiple layers of lawyers and attorneys to make sure they're covering bases and wording things correctly. And oftentimes it just leads to confuse more than anything else.
yes, yes. And people shouldn't be confused when it comes to information. To me, information should be crystal clear. A 2-year-old could figure it out
Yes.
because you're dealing with people at different levels. I mean, keep it simple. What is it? Keep it simple, keep it stupid.
Yep. Yep. Kiss, right? Kiss.
Yes, yes, that's right. That's back in the day talk. Well, Christian, we have got to do this again because this is really, really um have been very, very informative. I wish I had known you when I was first getting started because it was a nightmare, dealing with the process, even though there was somebody to help me. But like you say, I don't think they were as seasoned as somebody that probably really had been around a while and things like that. Uh,
Yeah.
so it was a bit crazy. But tell me quickly about your book. I see you're a published author.
Yes. Yeah. There's several books that I've put out now. There's some that I've put out for agents, so we almost have like two sides of our company now. Books where I'll mentor agents and kind of teach them really how to do things the right way, for their clients. Because if it's confusing for people on Medicare, it's also extremely confusing and overwhelming for agents when they first start doing it, and they just don't want to make a mistake or mess up somebody's coverage. And so there's a lot of fear and anxiety with that. And so there's some books I put out for agents, but on the Medicare side of things, there's a couple of books I put out about Medicare. One in particular, um, I believe it's called Medicare Guidance Picking the Plan for You. I published it almost 10 years ago. We've updated it multiple times over the years to be more current versions of it because as things have changed. But it's a very short, easy read. It's designed to take you through step by step what you need to know about Medicare, kind of like we've done on this show today, right? It'll walk you through original Medicare. It'll walk you through Medicare supplement plans and what you should look for, and it'll walk you through Medicare Advantage plans and what you should look for. Um, and that book, it's kind of amazing to me. It is sold over 5,000 copies on Amazon. It's been very popular. And so that's the first book I ever put out, and we've updated it a lot over the years. And it's probably the one I'm the most proud of because I think it's impacted the most people.
Yes, yes. So how do people get the book?
They could just go on Amazon. That's probably going to be the easiest way. You can either type in my name, Christian Brindle, or you can type in Medicare guidance, Christian Brindle or Medicare guidance. It should pop right up. It's a red and blue book with a Medicare card on it. It's very, very hard to miss.
All righty, Christian. Thank you so much for this wealth of information you just shared. Audience, I know you if gonna really, if you're listening to this, please reach out to Christian if you have any questions, although he explained this very, very well. But when you're going through it, questions always come up.
Of
So
course.
thank you so much, Christian, and thank you, audience, for tuning in. Appreciate you.
Thank you for having me, Ida. It's a pleasure, and I'm happy to do it anytime.
Absolutely. Thank you.